So we'll call the board meeting of Thursday, September 8th, 2022 to order for the Comox Strathcona Regional Hospital District Board. And the first item I do is I would like to acknowledge that we're conducting our meeting from the unceded traditional territory of the Comox First Nation, the traditional keepers of this land. And off to no in-camera meeting. Item C, adoption of the minutes, please.
Move adoption. Second.
Thank you. Moved and seconded. Any discussion? Not seeing anything, so I will call a question. Is there anyone opposed? Seeing none. Motion passes. Next item, the business. Any business arising from the minutes? No petitions and delegations. Reports funding to additional named facilities. So I will
move for receipt.
Thank you. And our CAO.
Thank you very much, Chair and Directors, and I'll ask James Warren to introduce this report and answer any of your questions.
Where?
Thank you, Mr. Chair. Good morning, directors, and this is a brief staff report to provide an update on the direction that was provided late last year through strategic planning to consider evolving and expanding the clinic grants to rural, remote, and Indigenous community health clinics and centers. The board expressed that interest to expand the number of potential recipients as well as increasing the grant amounts from $5,000 to $10,000 annually. The grant funding could be used by those centers for minor equipment purchases, renovations by the clinics, and other such activities. And the CSRHD would look for an annual report from those centers to describe how the funds were spent as well as future opportunities or plans. The CSRHD staff have reached out to sorry, I'll back up. The policy, financial planning policy has now been updated to increase the grant amounts to the original 6 recipients. And over the summer, the CSRHD staff has reached out to the noted facilities in the staff report, inquiring if there's an interest in receiving the funds. There's been an enthusiastic response from most of the clinics. And so our next step is to come to the board to seek amendments to the financial planning policy, as well as approach the province to have those facilities be named by the Minister of Health. Those are requirements through the legislation, provincial legislation. So as noted in the staff report, the recommendation is that we request Island Health and the Minister of Health to proceed with naming the additional rural and remote healthcare clinics as named facilities, that we would update the financial planning policy to reflect any named facilities, and also amend the 2022 CSRHD budget to enable the payment of $10,000 in 2022. And failing that, if we can't achieve that timing, then certainly that would be a consideration for the 2023 financial plan. And we're available for any questions you may have.
Super. Thank you very much, James. And I got Director Arbor. I'm going to make sure that there we go, I think.
Thank you, Chair. I think that I was so heartened when I saw this board in principle kind of agree to this a couple of meetings ago. And speaking for the Hornby and Denman clinics, I think for those in the municipalities, I'm sure you have the appreciation of how critical those clinics are to the communities, and they've been a bit the poor child of the medical system for some time. We're all aware of the shortage of doctors. We're aware of the problems on the North Island, and I think for us as a big board to show support in getting those smaller clinic being named facilities and putting, for now, a limited amount of money really speaks well to kind of the intent of this board to serve everybody as best as possible across our region. Thank you, Chair.
Thank you, Director Arbor. Anything further? Oh, I see some hands up. Director Abram, followed by Director Adams.
Thank you, Mr. Chair. Yes, I just wanted to ask James if, so basically we're talking about the list of names that you have in the staff report that we've already received. Is that correct?
Hang on 1 second while I figure shift.
Yes, Director Abram, it's the list of facilities that are noted in the staff report.
Okay, so just as is, and they would then also be, we would be requesting 10,000 for each of those.
Yeah, those are the ones that we have reached out to, and we would of course need to receive approval from the minister that those are named facilities, and then they would be eligible for the $10,000.
Okay, thank you.
Okay, Director Adams.
Thank you, Chair, and thank you, staff, for the report. Certainly, in speaking in support of the facilities that are named in the report to receive the 10,000. That being said, when the motion for the recommendation comes forward, I think it would be more prudent to have this in the 2023 financial plan, considering the late date that we're at in this calendar year already. I think that would be the more appropriate thing. My only concern is in the report, it talks about the potential of expanding beyond the main facilities that are recommended in the report. And if we are expanding the definition of healthcare clinics and facilities as suggested, my caution would be that this may open it up to a whole pile of social services agencies that sort of pseudo healthcare and may make it extremely difficult for future board members to make that determination of what is a designated healthcare clinic or healthcare facility, because I think this may open it up to a lot of people making an application with the premise that they are claiming to be a healthcare clinic or facility. Thank you.
And James, did you have any comment back on it? Your seat 6 or 7? Okay.
Thanks, and thanks for those comments, Director Adams. Certainly the board has the discretion to support any of these named facilities, and we do need to work with Island Health and the minister to request that they be named. So there are a couple of steps to go through before they do get named. But your points are well taken, and I think helpful for the board to consider as it progresses.
Okay, thank you. And I have Director Hamir, followed by Arbor and Unger.
Thank you, Chair. My comment is actually a little bit in line with Director Adams' comment. I was looking at the list of named facilities, and although I love this idea of supporting all of these more remote and rural clinics, the Wache Friendship Center, in my understanding, does not provide health care in the, I guess, a clinical setting. And I'm wondering if staff reached out to them, understanding that this grant is meant for capital equipment costs. Did Wache give an idea of what kind of equipment they would be buying or purchasing with these kinds of funds?
Staff did reach out to Wache and all of the all of the noted clinics and centers and facilities, and we didn't get into specifics in terms of the intended expenses, but certainly did talk about some of that preventative care and the community wellness services that are offered through Wache and also Lac-Otac Family Life Society as the two sort of kind of outlier non-clinical setting agencies. So nothing specific in terms of where the expenses would go, but some recognition that minor capital renovations, that sort of thing that can assist with their service delivery is the intended use of the funds.
Okay, and actually you've answered that, because the fact that they're doing preventative care, that I wasn't aware of. So that helps to sort of allay some of my fears. So thank you.
Okay, thank you. And are you 6 or 7, James?
6.
I have to get used to this system again. Director Arbor.
Okay, thanks. I guess I'll go again. Dr. Unger's there too, but thank you, Chair. I'll just answer to Dr. Amir and Dr. Adams. I think a big part of my support too, and I can't speak to all the clinics that are named, but I think it's good that for us to realize that these clinics also help keep people out of our hospital. And we know we've been pretty much at capacity. So whenever you've got, you can release some of the demand, that really helps us overall. I'd also point out that the requisition for the hospital board on Hornby and Denman is in the hundreds of thousands of dollars. And sure, the people attend our hospital, but most people attend the clinics on Hornby and Denman for most of their needs. And so I think to show that recognition is important. Thank you.
Okay, thank you. Director Unger.
Thank you, Chair. My only question is, if the board passes this recommendation today, is this open knowledge to the communities at this time, or do we still wait until approval from the ministry?
James? Oh, okay, hang on. Okay.
So the clinics and the facilities have all been engaged with. We've had conversations and some correspondence back and forth with all of the listed facilities and clinics. And our intent would be that we issue a press release if the board approves this resolution or recommendation. We would issue a press release that then would be available to the public and the communities in that sense.
Excellent. Thank you, James. Appreciate it.
Okay, Director Abrams.
Yes, thank you. I agree with the fact that Director Adams had some valid comments, and Director Hamir. I guess my assurance that this is okay to move forward with these and future ones that may come forward is that they're vetted by staff first, and our staff are totally capable of understanding, what these facilities are, what they do, and whether or not they qualify. So I feel comforted by that fact before it comes to the board, before it goes to the ministry, and I totally support the recommendation and the report that goes along with it. Thank you.
Okay, thank you. Any last comments? And Mike, my only point is we've had discussions with Island Health and they fully support the list. So it still has to go through the process of the minister, and there's no guarantee that the minister will sign off all of them. And so there is, in my opinion, it was a little bit of a concern to me about what services they provide. I know staff vets it well. I share Directors Adams and Hamir's concerns, but there is multiple levels of approval that have to go through. And so we ensure that it's the right thing to do. Who is? Oh, okay. Yeah, so we do have Island Health, Scott McCracken on the speaking as well. I don't know if you had any words you wanted to add at all, Scott?
No, thank you, Chair Cornfield.
Okay, and so on receipt, anything further? Seeing none, is there anyone opposed? Seeing none opposed, motion carries, and move on to the recommendation. So moved in second, moved on the recommendation. Moved by Director Hillian, seconded by Director Arbor. Director Adams.
I'd like to make a motion to amend the recommendation that this be included in the 2023 financial planning.
Second, Evans.
Okay. Pardon me.
So in the
2023 financial plan, I believe, was the motion that Director Adams moved and was seconded by Director Evans. So on the amendment, is there any discussion?
Mr. Chair, just to make it clear that this amendment would be amending the 2022 budget and instead putting this forward in the 23 financial plan.
Right.
Okay. Any further discussion?
Just if I could speak to
A
it.
question on that, Mr. Chair.
Hang on
Sorry.
1 second, Director Adams. I've got 3 speakers on the list right now, but I have accepted and it was moved and seconded for the amendment. So speaking to the amendment.
Thank you, Chair. Speaking to the amendment, knowing that we are in the final quarter of the 2022 fiscal year, by the time this all gets through, I think it would be more appropriate to have this in the 2023 financial plan with the funds hopefully approved and moved out in the first quarter so that these clinics and facilities can make use of the money. I think going back retroactively for 2022 isn't the correct course of action. Thank you.
Okay, Director Hamir, followed by Director Abram.
Thank you, Chair. I'm speaking to the amendment. I'm not going to be supporting. I believe we have a fairly sizable reserve that we can draw upon. I think many of these clinics have been sorely underfunded for a number of years. And with the healthcare issues we've had over the couple of years, I think, having an end of the year amount plus a 2023 amount would go a long way. So I won't be supporting the amendment.
Okay, thank you, Director Abram.
Yeah, I'd have to follow those comments and say that I too will not be supporting the amendment. We're basically in a healthcare crisis, and all of these facilities are helping us to try and get through that crisis. So I think that, a shot in the arm for, no pun intended, for the end of the year to the facilities would be much appreciated. And then we would move into the 2023 budget and do it all over again. So I would be supporting the original motion, not the amendment.
Okay, thank you. Any further discussion on the amendment? I just wish to add my comments, and I won't be supporting it either. I think the money is there. We still have many steps to go through, including approval by the minister to name them as facilities. Hopefully that can be done this year. If not, it would automatically roll over to 2023 anyway. And so I think we have enough controls in the existing motion. And I think anything we can do to assist them, as people have said, it's been a long time at the more remote communities. And in that interim, we built 2 fantastic hospitals. And now it's time to start looking after the outside ones. Okay, hang on, I got a shift here. Director Grieve.
Thank you, Mr. Chair. I think it's important to put this in perspective in today's inflationary climate. This is basically going to buy toilet paper and paper towels for $10,000. Thanks.
Okay. So on Director Evans.
Thank you, Chair. And I think you've clarified my question, and that was with regards to what would happen if approval does not take place this year, just in terms of the ministry's timing. And I heard you say that it would just automatically roll over into 2023. So I'm very supportive of this initiative. It was more just looking at it from the perspective of what happens when we're so close to year end. But thank you for clarifying that it would just automatically roll over if that was the case. Thank you.
Okay, thank you. Not seeing any other speakers. So I will call a question on the amendment to the motion. Is there anyone opposed?
Opposed?
Abram?
Amir?
Hang on, I got to figure out how to do it again. So, okay, I will pull the listed names. So Director Abram.
Opposed to the amendment?
Thank you. Director Adams.
Sorry, in favor.
Okay. Daniel's here. Hang on a sec. We're just making sure we got everybody on the list. Director Arbor. Yes. Opposed. Okay. Director Colburn's not here. Director Cole Hamilton.
Opposed.
Director Cornfield, myself, I'm opposed. Director Davis.
Opposed.
Director Evans.
Opposed.
Director Grieve.
Opposed.
Director Hamir.
Opposed.
Director Lee.
Opposed.
Director Kerr.
I'm opposed.
Director Hill. Director Hillian. Who was the? Oh, two Kerr. I'm sorry. Dr. Jonathan Kerr.
Also
yeah, that's okay. Director Hillian, I believe you were opposed. So Director Morin.
Opposed.
Director Unger.
Opposed.
Director McCollum. Melanie, are you there? Director McCollum. Hearing no response. Director Wally.
In favor.
And Director Grant is not here. Director Moblove.
I'm opposed.
We've done Director Kerr from Comox as well. So Director Polson, Sayward. Director Polson.
Opposed.
Okay, and Director Sullivan from Cumberland.
Opposed.
Cute.
Mr. Chair, Director McCollum put a message in the chat saying she's opposed.
Okay, we've got that. Okay, so on the motion, I believe it's safe to say that the motion is defeated or the amendment is defeated and we're back to the original motion. Pardon me. Yeah, there's a couple of hands up that I saw. Director Kerr, Town of Comox on the original motion.
Sorry,
okay. Is there any further discussion on the original motion, which is the recommendation? Seeing none, I will call the question. Is anyone opposed? I'm not seeing or hearing any opposition, so the motion carries. And we move on to the next report, the update to our regional hospital district signing authorities.
Move receipt.
Move the report.
Thank you. And through
Thank
to our
you. Thank you,
CAO.
Chair, and I'll just have Kevin Duval explain the requirements for the change in signing authority.
Okay, Kevin, oh, hang on. Yep. There we
Thank you
go.
very much through the chair to the directors. Good morning. So yeah, just a brief report in respect to updating all the signing authorities for the Regional Hospital District bank accounts. So in light of the recent arrival of Lucy Wacharek as our CFO, and also to update some other signing authorities within staff as indicated in the staff report, we just wanted to bring this report forward to make you aware and to get your approval to update these signing authorities. And then we will make sure we get that documentation out to the financial institution and update those accordingly. The three new signing authorities that are being added, of course, is Lucy Wacharek as our new CFO. We are also adding Katie Powell, who joined us last fall as our manager of financial operations. And then we also are adding Jake Martins as our deputy corporate legislative officers. So that'll give us a good capacity to deal with any signing that comes forward.
Thank you very much. And is there any questions? Not seeing any hands up and nothing around the table here. So on receipt, is there anyone opposed? Seeing no opposition, call the motion passes and move to the recommendation. Moved by Director Hillian, seconded by Director Grieve, and moving the recommendation. Any discussion? Seeing none, no hands up, no questions. Call the question on the recommendation. Is there anyone opposed? Seeing and hearing no opposition, motion carries. 3, long-term care facility advocacy, the report dated September 2nd. Thank you. Seconded by Director Hillian, and turn it over to our CAO.
Sure. Thank you, Chair and directors. This is just a brief report to inform you of the follow-up on the decision that you made to support long-term care and the advocacy being undertaken. Your chair and vice chair have done their best to meet with local MLAs to inform them, and Chair Cornfield can fill you in on that meeting because that has taken place. And the thought of our chair and vice chair was just to provide a briefing note to all of you that will be attending UBCM, as well as a list of the Treasury Board members for the province. And the event that you are meeting with them casually or bouncing into them at Whistler, you can have some speaking notes to advocate for this project and ensure that the Treasury Board supports the business case. And I'll turn it over to the chair just to say a few more words and about the good news about a possible meeting with the minister.
Yes, well, thank you very much. Regarding the meeting with the MLAs, Director and Vice Chair Hillian and myself, along with staff, had a fruitful meeting, I believe, with MLA Babchuk and MLA Leonard, MLA Osborne, our third member of the MLAs that look after us or are involved with us, was unable to attend. She had ministerial duties to look after, but we had what I thought was a really good discussion and questions from both of the MLAs. We talked primarily about the extended care facility or long-term care facility that's being proposed by Island Health. But we also brought up the medical hub, the healthcare hub. Yeah. We talked about the Comox Valley one. We also talked about the grants to the small communities as well. So it was to bring them up to speed and ask for their assistance in arranging for a meeting with the minister. It's been a long time coming. The have been reluctant to meet with us, at least over the last 8 years. And I know from my term prior when I was chair back in the 2010-ish area, was impossible when we had looked at trying to modernize the act. Anyway, I am very pleased to say that we have a meeting scheduled for the Thursday at UBCM between myself and I'm not sure if Director Hillion's going to be at UBCM. So anyway, we're working on briefing notes today after this meeting and to put an information package together to meet. We just got confirmation of the meeting yesterday, and then they changed the timing of it today. So I'm very pleased that we have that meeting directly with Minister Dix and to advocate for what the board has decided to go with. So yeah, I'm optimistic, and it put a smile on my face. So thanks to staff for all you do to make it happen. And as soon as we finish the briefing notes and sort of strategy, we will circulate it to all directors so that everybody has the same information as up to speed. And that's about it for at least my aspect of it. Director Abram?
Yes, thank you, Mr. Chair. Thank you for that report and for staff's report. So my question was going to be, do we actually have a meeting lined up with the minister at UBCM? And the follow up on that is that since, advocacy is, I believe, the strategic direction of our board, would it not be helpful if you had members from our board to back you up, not necessarily speak, but to be allowed to attend the meeting to let Adrian Dix know that, this is a board initiative and it's coming forward united from both regional districts that are on the regional hospital district. So anyway, that would be my suggestion, that as many members as you are allowed, be able to attend that particular meeting for, moral support and a good showing of support to the minister, that we're all on the same page on this and we would really like to see it happen. So I would happily volunteer to attend that meeting from the northern perspective, and hopefully others would do the same. So that's up to you, I guess, or up to the board to decide who it is that's going to meet with the minister.
Okay, thank you, Director Abram. I've got Director Grieve followed by Director Lee. Oh, hang on, shift.
Thanks, Mr. Chair. Just a comment. I think this goes a long way to support my long-held belief that members of senior government do much better when they spend their formative years in municipal government. So here we have 3 members that have all served on councils and regional districts, and it makes a huge difference. Thank you.
Thank you, Director Grieve and Director Lee.
My question is, the report says that we are willing to cost share, but it doesn't outline the 60-40 traditional breakdown in how we cost share. And also this long-term care facility in Campbell River hasn't been on the list of named facilities. We just finished doing a list of named facilities, and are we going to start funding all long-term care facilities or just the named ones? So maybe it's premature to name them as a facility because we don't even have approval from Treasury Board on building anything. And so I just wanted to know, is it a 60-40 split? And is it only in relation to the Campbell River Long-Term Care Facility, and will it be named if it is?
Hey, I'm going to turn it over to our CAO first.
Sure, Mr. Chair. And yes, 60-40 split, and we'll be sure that the briefing notes make that clear. Yes, it only applies to this specific facility because that's the direction of the board, and it will require that it be a named facility to receive the funding, and that will be up to the province to undertake and do.
So because it wasn't on the named facility list, I imagine that this is quite a long way off, probably.
Mr. Chair, it is a little off in terms of the time of delivery of the project. The first step is for the province to provide their support for their share of the funding, and this advocacy is all about that, encouraging them to provide that support.
Okay, thank you.
Okay. Director Unger, followed by Director Unger.
Okay, thank you, Chair. I just want to clarify from the email I got from Teresa Lawrence this morning. For this meeting would be Chair Cornfield, Chair Keller, myself, and staff, and it's for Tuesday, September 13th at 11 a.m. Just want to clarify the time. And the attendees.
I haven't had a chance to look at my calendar yet, but I know what the change.
Yep.
So it's gone from the Thursday to the Tuesday?
Tuesday at 11, yes. And just for the board's knowledge, we've organized this at this time to include the chair. Unfortunately, the vice chair won't be at UBCM, but the chair of the SRD and the chair of the CVRD to show broader support. But if this board or the chairs decide on others to attend, by all means, staff are there to support.
Okay, thanks, Russell. Just for clarification.
Yep. Is there anything further? Okay.
Just quickly, Mr. Chair. Yeah, just real quick. So on my comment about including others, what's the board's wish on that?
Well, partly it's not up to the board or to us. We requested a meeting, which we've been given. I don't know what constraints they have. What was sent in was to give some representation from the entire board and over the entire service area, which was why the chairs were invited from the Comox Valley Regional District and the Strathcona Regional District. Before I could make any comment back on saying, yes, let's open the doors, we need to follow a process, and that's to go through the minister's office, which staff will be doing. And of course, we have to get our briefing note done and the asks in before next week. So yeah, it's a tight schedule. It was very late approval when it came through the other day. And yeah, and now it's changed from Thursday to Tuesday. So,
okay.
Yeah.
As a follow-up,
it's evolving, Jim, as we go. So I can't really say, yes, we're going to do this or we're going to do that, not without checking with them first.
Yeah, I understand that. But it's been my experience in all my ministerial meetings over all my years at UBCM that whomever shows up at the door in their office, in their waiting room to go in to see the minister, they always accommodate those number of people. And we've had as many as 15 people when only 2 have been designated on the list that goes to the minister. So I don't believe at the ministerial end there's a problem. I'm just asking here at this board, is this board willing to stretch the parameters a bit and say, interested members that are available at that time to be able to go to the meeting? If that's the case, then you can then ask the minister's office if that's okay with them. If so, then we do it.
Okay. Good, asked and answered. I will, I have two further speakers, Director Moglove, followed by Director Adams.
Thank you, Mr. Chair. I'm strongly opposed to widening the representation at this meeting. I think that it should be the chair, the vice chair, and perhaps the chair and vice chairs of the two, the chair and or vice chair of the two regional districts that form the joint board. I think it's really important that at this meeting we speak with one voice, and that voice is the voice of the chair and the vice chair. And so I think it would be very counterproductive to widen the representation at this point in time. Thank you.
Okay, thank you. Director Adams.
Thank you, Chair. I concur with the comments of Director Moglove and would also just say that if there is an opportunity for others to participate, it would be in a volunteer supporting capacity only.
Okay. Thank you. And before I go back to Director Abram, and I've also been there for the last 25 odd years for at meetings. I've had meetings where we overwhelmed them and we were told at the end of the meeting, don't do that again. I think we're very fortunate to have a meeting that we've been trying to get with the minister for a very long time. I think we have to make the most of it, and that's to be respectful and remember that we've only got 15 minutes. The other MLAs will be there. Babchuk and Leonard, as far as I know, are in attendance and will be participating as well. So I think we've got the key group that needs to be there. And, but I will, it's up to the board. Yeah, there's no motion on the floor. And I think if possible, and we can try and see, but it wouldn't be my recommendation. So Director Abram, to close it off, final comments?
Yeah, just very quickly, I agree with Director Adams' very last comment, and that was exactly what I said, that it'd be a volunteer observational attendance only. We're not there to speak, we're there to provide visual support to the chairs and vice chairs of the two different boards. That's all. And being from rural areas, supporting a facility that is in a municipality is certainly something that I'm sure that our MLAs and the minister would take into consideration as being a positive. So, that's all I'll say, do whatever you please, but that would be my wish.
Okay, thank you. Anything further on item 3? We had a motion to receive, did we not? Okay, so it's on receipt. Call a question. Is there anyone opposed? Seeing none, receipt motion carries. Item 4, the Comox Strathcona Regional Hospital District Management Report.
My receipt.
Thank you. Thank you. And Russell or James? That's it. No updates required. Any questions on it? Director Hemier.
Thank you, Chair. I'm actually wanting to speak to an item that I don't see on the management report. I'm wondering if staff can maybe jog my memory as to where we left off the hub project for the Comox Valley. Not seeing it on the management report kind of made me worried that we're no longer working on it.
Mr. Chair and directors, the staff continue to work with Island Health on the hub. It is a matter of Island Health defining the programming and space requirements for the facility, and for us to assessing that and coming back to the board probably in the new year to present the results of that and the type of building that is being proposed, the program requirements and spatial requirements. So it continues to be worked on by both staff of the regional district and Island Health.
Thanks for that, Russell. I'm just wondering if it should be put on the management report so that the new board is aware that this is happening, and because I know we haven't talked about it since probably April, and whoever is elected in the fall should have that show up, unless you need a motion for it to be put on the management report, which I'd be happy to do.
It probably stems from the work plan that was adopted as part of the budget, as opposed to a specific motion or direction that are traditionally the part of the management report. But we will reflect on that and ensure that the management report for the new board includes any of those ongoing activities so that they're informed of that.
Thank you.
Okay. And Director Hillian.
Thank you, Chair. And I just want to thank Director Hamir for bringing that up and to reassure the board that when we met with the MLAs, we certainly spoke about the hub project and made sure they understood it and were supportive of it. Thank you.
Okay, anything further? Yeah, just to, okay. Scott, can you give us, Scott McCartan from Island Health, or if you could, is willing to give us a bit of an update of where the hub sits.
Thanks, Chair Cornfield. Yeah, actually, we just received a final report from our functional programming consultant on, as was described, the type of space and the functional program that we'd like to see in a new facility. That's being reviewed by our teams at the moment, and once it's finalized and endorsed, it will be translated into more of an indicative design. And once we have that, we'll have a better understanding of scope and scale of the development, and can bring sort of estimated costs and timelines back to the board for their consideration. So we're moving. A little bit more work to do, but it's definitely on the go and one of our top priorities.
Okay, that's one of the things I explained to when we met with the MLAs. That the board direction was to continue exploring, working on the health hub. And it's good to hear that it's where you're getting a little closer to defining the project, because it needs to be defined before the board makes an informed decision. So we're not ignoring it. We have been promoting the concept, but also with some degree of caution, because it's up to Island Health to put things together and get it approved and where it fits in their work plan. So yeah, we'll keep everybody posted as things move forward. Director Morin.
Thank you, Chair. I just thought while we have Scott here, I'd take the opportunity. This may be one of my last appearances. We'll see what happens. Just in terms of going off in this direction, I'm wondering how much in sort of public engagement or feedback from users, patients, clients for this type of hub, what kind of input would be considered. The reason I ask this is I know that with the new hospitals, I'm sure there was, a lot of public engagements about what the facility should be like. However, I know that the psych ward, as an example, unfortunately, through my work, I've taken people to the psych ward, and although the care there is great and there's all kinds of amazing positive things, there's things about the actual rooms and building and the built environment that's not as conducive to folks experiencing mental health. And I know that we also have some other models in the province that look at standardizing Foundry is one example. Another amazing facility, great staff and great programming, but has that sort of more, I guess, that standardized look that doesn't have that human feeling to it. And I guess I think about this more because of my, over 25 years of work with folks with mental health and addictions, as well as other health issues, that built environment is so incredibly important. So I just wondered what the process was for something like these hubs before we kind of get, the paint dry in terms of input from the people who actually use those spaces. And, we're trying to reduce barriers for people, but yeah, that's my question. Thank you.
Okay, through to Russell.
Yep, Mr. Chair, the hospital district will have the opportunity to consider the process that it undertakes if it proceeds with this project. This initial step is really Island Health looking at the requirements for the facilities and purposes for which they require space. But as this will be a build of the regional hospital district, it will be very much within your control to determine the public process and what we do to undertake the opportunity, for instance, for other uses in a facility if it's built by the regional hospital district that may be compatible with Island Health, but serve the purposes of the community. So lots of opportunity for engagement and input from the public in the event that we continue with this project.
And just to put your mind at ease a bit, there was a huge amount of engagement with the professionals, including doctors, nurses, the janitorial services, the cleanup people. Well, Island Health built model rooms here in the valley so that they could take groups of the professionals that would be using the room to help design it. And it's as good as you could possibly have. And it wasn't based on us or my experiences, but it was based on the people that were going to be using them, that have the patients all the time. And it was based on their professional opinion that designed the rooms. And it was an extremely effective process. And so
I appreciate that, Chair. I know this is a process coming in the future, but the professionals don't always know what's best for the people who actually come into the space. So I do appreciate that. It needs to be a collaborative approach, but let's not forget the people who actually are utilizing the services. Thank you.
Okay. Thank you. Anything further on the management report? If not, we'll call a question on receipt. Is there anyone opposed? Seeing none, motion carries. So bylaws and resolutions, none, no new business, no addendum.
Motion to terminate.
Thank you. Moved by, I believe, Director Adams, seconded by Director Arbor.
Before you do that, Mr. Chair, could I just say one thing?
Yes.
Okay, so I believe you said, Russ, that this is our last total gathering of the group. Is that correct?
Correct.
Before the November, whatever.
October 15th.
So I just wanted to say to everybody, as you probably know, I'm not running in the next election. So I just wanted to say that it has been an extreme pleasure and privilege to work with every one of you over time, and all of the previous directors over time. This is my 35th year, and with I'm probably been there longer than most of your staff, but the staff that are still there, all of you, you've been fantastic to work with. You do a really, really good job at what you do. And I really appreciate having the honor and the opportunity to have been a part of this board, a part of the formation of healthcare in the regional, the hospital district. And I'm going to miss all of you. So thank you very much.
Thank you very much, Director Abram. And I think I say it on behalf of the board that I thank you for your years of service, both to your constituents in your electoral area, but to the people in our joint service area and all the work you did to improve healthcare. So thank you. And I've got Director Arbor.
Thank you, Charlie.
And as someone who's first term and just got to know you, I also want to thank you, and your legacy lives on in places that maybe you don't even expect it would live on. I was reviewing the public hearing in Union Bay a number of years ago when Comox Strathcona was one regional district, and of course I found that you were chairing it, and so I think you leave many accomplishments and a strong legacy behind. So thank you for all your work.
Good,
Thank you, Director Arbor.
And Director Abram, go look on the chat thing too. There's a couple there.
I will do that. Thank you, Charlie.
Okay. Anything further? So on termination, yeah, I don't know if I'll be back next time. I am running for the position of mayor for Campbell River. But this could be my last board meeting. And I just want to say it's been a pleasure and an honor to chair this board over the last 8 years. And we've done things through the board's permission that no one else has. We were the only ones to take up strategic planning to look at where we were going to go and how do we get there. That incorporates all our community's needs. So I'm very pleased to have had that position and the support of the valley and the river, as I call it, and the board that works together. We may disagree, but we know how to disagree in a respectful manner. And I'm very pleased to have been here. So thank you very much for the honor. Seeing nothing further on the motion to terminate. Anyone opposed? Oh, deafening silence there. So is somebody actually? No. Oh, yeah. Okay. Yeah. Okay. Thank you, Director Davis. Look after Tassus. Yeah. So